the Real News Network. I'm Sharmini Pierce coming to you from Baltimore. The Affordable Care Act, which is also known as Obamacare, has suddenly become a major presidential campaign topic, with Donald Trump saying that he would repeal the law and Hillary Clinton saying that she would work to improve it. Here's what Donald Trump recently had to say about the premiums of the Affordable Care Act and the increases within it.
And in case you haven't heard today's news, it's just been announced that Americans are going to experience yet another double-digit spike in your premium for Obamacare, and it doesn't work. In some areas, they're paying 60, 70, and 80% more than they were paying last year. It's over for Obamacare.
Now let's take a look at what President Obama had to say about the premium increases himself.
Now, it's these premium increases in some of the states in the marketplace that sometimes attracts negative headlines. These premium increases do make insurance less affordable. There are going to be people who are hurt by premium increases or a lack of competition and choice. And I don't want to see anybody left out without health insurance. So the question we should be asking is, what do we do about these growing pains in the Affordable Care Act, and how do we get the last 9% of Americans covered?
Joining us now to take a look at Obamacare at the center of the presidential campaign is Dean Baker. Dean is co-director of the Center for Economic and Policy Research. He's the author of several books. His latest is Rigged: How Globalization and the Rules of the Modern Economy Were Structured to Make the Rich Richer. Good to have you with us, Dean.
Thanks, Sharmini.
So, Dean, Donald Trump, no doubt, is using scare tactics when it comes to this 80% increase in premiums and so on. But the fact is that earlier this week, the government did say that premiums would go up by an average of 25%. That is no doubt a hefty increase. Explain to us how we got here.
Well, there's a couple things. First off, it's important to recognize that this is just referring to people who are on the exchanges that are run by the federal government. That's 39 states, roughly 9 million people. So we're looking at average increases of 25%, which is a bad story, but important to understand this is not the whole system. It's a relatively small portion of, we have somewhere around 260 million people that are insured. So this is a relatively small portion. Second, the point about the premium increases that, often gets left out of the picture, premiums were actually lower than was expected when the system first went into play in 2014. So if you look at what the projections were back before when the bill was passed in 2010, we're pretty much right on track with the higher premium increases for 2017 with what had been projected. So again, that's not a good story. That's not going to make anyone happy that this is what was projected. But that doesn't mean the program's off track. It's actually pretty much what was expected. The other point that has gotten lost in the shuffle is that the vast majority of people who are getting insurance on the exchanges are getting it subsidized. So roughly 80% of the people who are getting insurance on the exchanges will still be able to get a policy that with the subsidies will cost them less than $100 a month. Now, that doesn't mean there aren't still some people who are going to be stuck paying a lot of money for insurance. That's a big deal. It's a serious issue. But that's not most of the people who are getting insurance through the exchanges.
Now, Dean, what do you make of having the whole bill repealed versus fixing it? Which side do you fall on?
Well, if you say we're going to repeal the whole bill, we got more than 20 million people insured through the Affordable Care Act. So basically what you're saying is those people lose their insurance. Trump says he's going to replace it with something terrific. If you had something fairly specific that you could look at and compare it to, some of the things he's talked about are old ideas, that you would allow insurers to market across state lines. Essentially what that means is states would have no ability to regulate. So the whatever state had the least serious regulations would be insurers could register there and then sell everywhere. It's not clear that reduced costs. It certainly would reduce regulation of insurers. The other things, he really hasn't been clear how you're going to make sure that people with pre-existing conditions, to my view, the most important part of Obamacare, that they could get covered at the same price as everyone else. How are you going to make sure that happens? He has nothing to say on that. So saying, that we're just going to throw out Obamacare, to my view, sounds pretty crazy. Now, we should talk about how you get costs under control, how you ensure that the people who aren't covered can be covered. Those are really big issues. And, Clinton has put some things on the table. I'm not going to say they're perfect, but, one of the things I like a lot, having a public option, let everyone buy into a Medicare type plan. That would be a really good thing, provide competition. So even if people stayed in the private insurers, there would be competition from hopefully a well-run public system. So there are things you could talk about, having larger subsidies and, certainly getting costs down by doing things like paying drug companies less for their drugs, medical equipment companies, highly paid medical specialists. There are things that can and should be done. How much Clinton would be prepared to do if she gets in the White House, I guess we'll see.
Right. Dean, according to a recent New York Times article, annual deductibles can be as high as $14,000, and with an annual premium of about $4,000 for a household with an annual income of $62,000. If there is a major illness in a family, that could still spell bankruptcy for a family spending almost 1/3 of their income on premiums and deductibles. So do you think part of the problem here is really what you identified earlier, the issue of competition trying to drive prices down?
Well, in a lot of the markets, you don't have enough competition, but part of the problem is that the situation you're describing is really like someone in the worst possible position. So they're still moderate income, 62,000. It's not high income, very middle income. So what that means is they're not low enough to qualify for subsidies. On the other hand, they're in a situation where they could be looking at very substantial premiums, particularly someone who's in the oldest age group for the program, 55 to 64, pre-Medicare age. So you can have people in that situation. Fortunately, not many people are, but there certainly are some, and that is a serious problem. Now, competition can help. We've had a lot of insurers leave the market. They're not making money. If you got more insurers or a government plan, that can help. But part of the story is simply that healthcare in our country is very expensive. So, even with competition, the point is, in this family you're describing, their expected medical bills will be expensive. So without some form of subsidy, they are looking at high costs.
Dean, when the law was first passed and when President Obama was campaigning back in 2008, a lot of his critics felt that this kind of law in terms of healthcare was a giveaway to insurance companies because it allows them to continue to make billions of dollars off of people's healthcare, and then to be faced with this kind of situation where the premiums go up quickly over a matter of a year. Do you think that's a fair critique, and this current situation confirms that suspicion?
Well, Obama clearly made a deal with the insurance industry to at least get them to be neutral, if not actually supportive of the bill, and whether that was necessary to get the passage or not, hard to say. He didn't have a lot of room for error in terms of extra votes when it came to either the House or Senate. So, whether they would have been able to stop it had he not accommodated them, hard to say. But in terms of how well they're doing in this story, the fact is the insurers are leaving the exchanges, and they wouldn't be doing that if they were making a lot of money on it. So I don't think they're making out like bandits per se. I mean, could you have envisioned that a story where they would have done worse? Well, certainly if you'd gotten a Medicare-type public option included in the exchanges, they would not have liked that, and that probably would have depressed their profits. But again, he didn't have the support to do that. Could he have pushed harder and gotten it? I guess that's something we'll never know. I would have liked to have seen him push harder. But again, I don't think the insurance industry is making out so great on this. If they were, they wouldn't be leaving the exchanges.
All right. Now, finally, describe to us what the public option actually looks like that people could fight for.
Well, the idea of a public option is having a Medicare type plan. I keep saying type because, probably wouldn't be exactly Medicare because, you'll have issues. Medicare doesn't cover childbirth for kind of obvious reasons, So, you'd have a different sort of plan, but the idea would be that it'd be run by the government and presumably have lower costs. Medicare is considerably lower administrative costs than private insurers and, of course, not making a profit. So if you had that as an option for people to buy into, throughout the country, then both, in principle, you'd at least have one good plan that people would be able to buy into. But on top of that, that would put pressure, the competition would put pressure on the private insurers to keep costs down and quality up.
Now, of course, the critique of something like Medicare for All is that, people claim that there are long waiting lists for surgeries and to be seen, and you don't have a choice of the doctor you want to be seen by, and so on. Could all of that stuff be fixed in a public option as well?
Well, presumably a public option would be along the lines of the current Medicare system. So, Medicare does, most people are able to get, their doctor through Medicare. Obviously a doctor could refuse to accept it, but most doctors do accept that. So I think, that should be sort of a good guide as if you had a Medicare type plan in the exchanges that would be comparable in its range of options to the current Medicare system.
All right, Dean, I thank you so much for joining us today.
Thanks a lot for having me on.
And thank you for joining us on the Real News Network.